Um, so I'm here with Dr. Mármol, and everybody has had a ton of questions about you. I think one of the main questions is BMI. What is the maximum BMI?
BMI, the maximum that I do surgeries is 40.
Okay.
40. Under 40, good.
And I have had, and someone wanted me to ask you this specifically about,
Really?
yes, it's not a good question. It's about thigh lifts, and I've explained like the complications that come with thigh lifts, and maybe it would sound better coming from you.
Oh, about thigh lifts.
Mm-hmm.
Yeah, the thigh lifts, there is like, short, then the medium, and then like a long thigh lift. I mean, because they are two legs. So there is like a part in the inguinal part that with the movement, I mean, most of the time can open the wound. Like it's normal. So it's not like the tummy tuck, it's not like another kind of surgery. Thigh lift is like a special. So you need a very good special care in taking care of the wound after surgery. But I have a testimony of patients there. They told me that they want to use shorts and short dresses, and they can because of the thigh. So after the thigh lift, they can put any dress. So they are happy. But that is the thing. You have to take care very, very close the wound after surgery.
Okay.
Mm-hmm.
And I see you have Motiva implants there. Is that the brand of implant that you use?
Oh, I use, there is a lot of brands, but Motiva is one of them that I use. It's really good brand.
Okay.
Mm-hmm. And also, it has the last thing is this microchip. Do you know?
I'm wondering if mine have a microchip.
This is the newest. You see the microchip, so it's like, to have the information, because when you put breast augmentation with breast implant, with the time you forgot what you have, the CC, the number, how it is, the texture. So with this, you put the implant, and then they're going to tell me the information.
Now I don't do implants because I'm one of the people. I think I have 250 cc's, but I don't know.
Exactly.
I know that there's a serial number on my implants, but I
Yes.
lost that card long ago. So
Exactly. With this information, your plastic surgeon or your next plastic surgeon will know before surgery what implant do you have. Because when we do secondary surgery, we don't know. We open the breast, and then I see she have 355 cc, but we have to open the breast. But with this technology, you can know all information before surgery. Like the future.
yeah, I'm so jealous. So are those gummy bears? Are they silicone, saline, or?
See, we are using breast implant like long time ago. So now the technology is like a mix. It's for example, you touch it, you touch this, and you touch this.
This one feels more natural.
Now it's like that. It's like a mix. It's like mixtaline, silicone, and it's called micro texture. This one. Because there is a several brand and kind of breast implant. In the past, was all like smooth.
Mm-hmm.
Then like that, yeah. Because this implant, when you put inside, don't move because attached.
Right.
But also maybe the bacteria can grow with this surface. Now we use this. It's like a mix because it's micro texture.
Okay. Let me see what other questions
Hi,
they
Katrina.
asked me that I can't remember.
Katrina.
Are there certain days that you do surgeries? Like some doctors will do Saturdays, some won't do Mondays, just whatever.
Which day I don't do surgeries?
Mhm.
Weekend.
Okay.
Weekends, yeah.
That's easy.
But I still do surgery Monday to Friday.
Okay.
In the past I used to do Saturday, years ago.
Yeah.
Yes. But we're still working because, for example, this weekend I have patients that they came the Saturday, the Monday, and we start the pre-op test.
So can they get their labs done here on weekends?
See, yes. For example, if you reserve for Monday or you reserve for Tuesday, most of the patients they came Saturday or Sunday. They start the pre-op.
Okay.
They start the blood test and the diet, etc.
Okay. How many days would they be in the clinic? Like, would they stay the night before, or is it just the night of surgery?
Depends. Most of the time, the patient came 2 or 1 day before the scheduled surgery, and we start the pre-op, and then the next day, early in the morning, they came to the clinic, and we do the surgery, and she passed 1 day in the clinic, because I like to see the evolution here, 24 hours. Okay, and then the next day they go home to the recovery home.
Okay.
In some cases, they stay 1 night before. For example, today. Today I started very early in the morning. I started to do surgery 5:30 a.m. So it was too early. So the first patient, she passed 1 night before here, but that is like 1 patient.
Okay. How many surgeries a day do you do?
3, only 3.
Okay.
2 or 3.
Okay.
No
And
more.
as far as diabetics, what would their A1C levels need to be?
Yes, that is very important. The normal is 6.5, but in some cases depends. My endocrinologist, because we have a big team, she's the one who can and who not go to the surgery. And some cases, depending on the patient, she allows 7
Okay.
A1C. I have a case of a patient that she spent 2 weeks here doing a treatment that my endocrinologist put on her, a treatment and diet, and she couldn't do the surgery. So it's very important. If you know that you have this situation, you can send me your pre-evaluation. You can go to your doctor in your country and you can ask for a physics laboratory, and then you can send me or my assistant, and then we can see your glucose level and your hemoglobin A1C.
Okay. For a mommy makeover, everybody wants one. What would the hemo need to be?
All my patients, have to be 12 or up.
Okay.
For my makeover, I choose the patient. Have to be a patient. Because if the breasts are too big and the tummy are too big, it's not safe to do all together at once. It's not because of work. Because for my team, it's more work. It's because of you, for your sake. The Mobile Makeover depends. We choose the patient if they qualify. For example, if the work in the breast are not too long or not very complicated, we mix with a tummy tuck and lipo and BBL. Yes.
Can't think of anything else. And I know as soon as I leave, somebody's gonna hit me with questions. I can't think of them.
Not everybody wants now Vincent look.
Yeah.
It's like everybody, I mean, they ask me, you ask me, I want a tiny waist and big hips.
Can you do Vixen?
Yes, I mean, but you know, and the patient know. Now with the time they have more information and they know everything. If you want like very tiny waist and big hips and more, and a big butt, may you need 2 rounds or more to have that desired round.
And
two
so,
rounds.
do you accept like wish pictures? Could they bring you a picture and tell you this is what I want to look like?
Of course, definitely.
Oh.
Of course, I mean, in all my patients, I ask for a wish pic. Most of the cases in breast surgery. In breast surgery, I ask you to wish to bring me out so I can see in your mind what do you want, and also I evaluate what you have in your body. So we decide with that information, your wish pic and what you have, how many cc's do you need. That's what I work with breast, for example.
I think those are like the main questions that everybody asks. Other than that, I can't think of any.
Now let me tell you that when we are doing surgery, I mean, and we put the patient and we see the pre-op, and then when we finish and we see the change, we say, oh, plastic surgery, I mean, it's big. I mean, it's like something big. And when I see as a surgeon the result immediately, and I say, oh, this woman is the bomb. She's going to be the bomb in her neighborhood. So we feel great and we feel good when we have good results. And when you call me and say that you are enjoying your life and your body, that makes us happy, my team and I as a surgeon.
What would make one fail their labs and not get to have surgery? Like if they come in for surgery and their labs come back, what would make them have to wait days, or what would make them not be able to have surgery at all?
Oh, for example, if the hemoglobin level is very low.
Okay.
It's very low. I mean, there is a lot of things to do. We can put like injection with iron or erythropoietin, or the one that I'm using is called Ferinjet. So, but we have to give time. We have to give 1 week or 2 weeks to wait for the right level of hemoglobin, for example. That is, and also the glucose level, the A1C. All that, the urine, if you have infection, you can do the surgery. Any situation, heart situation, due to asthma or smoke, because we have, I mean, I'm the surgeon, but we have a big team that they look for your health. And for example, the endocrinologist, the pneumologist, they now it's mandatory after COVID. All patients have to they have to do a pneumologist evaluation.
Okay.
For example, that is very important. Before I only use my pneumologist when we have a situation, but now it's mandatory with all patients.
Thank you.
I thank you for coming. I really appreciate it.
You're welcome.